We recently did a survey where men reported that about 1 in 3 of them are highly stressed, and yet only 4% of them are taking therapy. This is strange, but what is even more strange is that despite therapy being free for all loop members, only about 7% of men have ever taken it. This is scary, especially if you know that about 75% of all suicide deaths are men. Why are men not taking help? We interviewed 3 therapists with very diverse range of experiences to understand why is it that men are not taking help. Is it the stigma? Is it still relevant today? What happens when a man actually enters the room? What is it, or how do they express their problems? And what happens when it goes too far? We spoke about suicide, we spoke about protocols, we spoke about how men actually feel once they've completed the first therapy session. There was so much discussed, there were so many insights that we realized and that I understood personally as to why this behavior exists in the first place. This video might help them understand why they are feeling this way from therapists and hopefully make it easier for them to take help now before it becoming too late.
Camera's on, recording, the mic. Alright.
You want me to start with a hi or?
It's like normal conversation. Hi, hello, how are you?
Hi Shmeet, how are you?
I'm lovely, how are you?
I'm okay, thank you.
Okay, just allow me 1 minute. Alright.
My name is Jerry Jacob. I currently live in Ahmedabad and I'm currently working as an assistant professor.
My name is Saanchi Aggarwal. I'm a counseling psychologist.
Hi, I'm Nishtha Budhiraja. I'm a clinical and a neuropsychologist.
How long you've been practicing? What have your most cherished experiences been while doing what you're doing? How's it all going?
I started my career as a child psychologist. I've been working with Loop Health for about 4 years now. With Loop, we have kind of worked together with the medical team and the wellness team to set up the mental health protocols.
They're currently posted in a government setup where I even provide academic lectures as well, and as well also train the students of MPhil clinical psychology, the trainees over there. I also work as a consultant psychologist in the platform Loop.
Even though men are highly stressed and the double suicide rates are much like quadruples higher in men and between men and women, therapy is a proper procedure that men can take in order to get better, and yet there's this very evident gap. Our hope is that a person who needs therapy is viewing this, so when he sees this video, he feels okay, cool. We're sort of disarming the knowledge, making it simple for them to understand what it looks like in the first 15-20 minutes to make it easier to take therapy. And then by the end of the session, the hope is that they're like, yeah, it doesn't sound so bad. Let me just take the first step. Success would be if more men because of this take therapy.
Therapy in India culturally is a taboo to talk about. So for me, my therapy style is very upfront, straightforward and transparent. I don't lie to my clients also because I can't and I choose not to. I don't sugarcoat things. I do ask them if they have the bandwidth and the energy for a truth bomb right now, or would we want to build those internal resources over the next couple of sessions, and then I'll share something.
So when we kind of psychoeducate a patient, especially men, they kind of concluded, okay, so we are just talking, we are just having a conversation. So the question that arises up in their mind is, how is a talk going to help me? So it doesn't make sense to them. In their mind, it's kind of genuine, not very sure of how just having a conversation would help my case. So men are usually kind of problem oriented. They need solutions as quick as possible. Men in general, I would not say everyone, but men in general do find it difficult to understand and recognize the emotions that they are feeling.
For men, talking about how they're feeling is very difficult because the idea of a man in the society is they would talk about how things are getting difficult at work. They look at it with a very logistical perspective.
Me as a professor, I kind of have to put the trainees in the front. Okay, so to deal with the patients. So there are a very few male practitioners.
My friends who are male therapists, that male clients and male patients prefer them over female therapists. So accessibility towards having a male therapist is very different, because when we talk about numbers of male therapists versus numbers of female therapists, uh, the math doesn't match. You don't have 50% male therapists and 50% female therapists.
So men often do feel kind of insecure, or they are not kind of very open to cases, especially when you are kind of dealing with any kind of sexual dysfunctions, any kind of sexual histories, where probably men will feel inadequate, and probably they are not comfortable in sharing.
A lot in therapy wherein men have been sexually assaulted or harassed, but they can't say that out loud. If you look at child sexual abuse statistics, 50% of children have been assaulted or abused as children. Now, these 50% children are adults now or would be adults in the future. A perpetrator would discriminate or maybe would not discriminate with your gender or assigned sex. Nevertheless, it is important to kind of validate someone's experience if they're saying that I was assaulted. As friends, as people that someone would have shared this with, you can't say that, oh, you're a man, what the hell were you doing? Oh, did you not enjoy it? So, all of these things reinforce the predatoriness in the systemic oppression that's there for a victim, irrespective of gender. And I think this has to come to the forefront, where men can be victims. Sometimes they are. Sometimes they are victims in an intergenerational trauma cycle. Sometimes they could be victims and perpetrators at the same time, that they could be suffering.
Vulnerability and judgment are the two things that can stop a man from going to therapy. They don't want to seem weak in front of anyone else.
Those things need to be kind of talked about within silos of families. We guys don't talk about finances.
Yeah.
Difficult conversations do not find themselves in the mainstream space of, let's say, a dinner table conversation with a family member or family members for that matter.
When you spoke to these people and who were clearly in need of help, since how many weeks, days, months, or years were they keeping the problem inside them?
Men generally do become emotionally numb to their situations. So it is when, to the extent that it is impacting them physically, that's when they come for consultation to the psychiatrist. Until then, they do not come for any kind of treatment.
There is this stereotypic image that we have in India, that how a man should be, how a woman should be, how a child should be. For example, if I say that, oh, men's mental health, you'd be like, hey, doesn't exist. A boy is born, goes to school, goes to college, gets a job, earns X amount of money, starts climbing up the corporate ladder, has a family, has a bigger house, has a bigger car with each passing phase in life. And that's what men are supposed to be doing. They should be doing. It's almost like you've thrown the child in the deep end of a swimming pool and you're expecting the child to automatically know how to swim.
The conception that this is going to happen in therapy, I have to talk about my biggest fears, I have to talk about my feelings all day, would create a pressure on them to not opt for it as much as women would.
But if in women, when they are going through this emotional crisis as well, there's a high chance that they'll seek the therapy then and there, because of that recognition of the emotions, the emotional turmoil that they're going through.
So if a man comes into therapy, they would list out the physical symptoms first. I can't sleep at night, or I don't have the energy that I used to, or I'm feeling very tired when I wake up, I'm not well rested. Men talking about their emotions, telling how they feel, and actually scraping the surface and looking beneath it is something they actually haven't learned how to do while growing up, or it was never taught to them in a way that they're comfortable with the idea.
What are they being taught with? To be avoided with their emotions, and when they are avoiding with their emotions, you try to focus on other aspects, so that you're kind of distracting yourself so that you don't feel that emotion.
Correct.
But then that builds up so much that at one point of time it kind of affecting different areas of your life, different domains of your life. That's when they understand, okay, now I need to go. Those are purely physical symptoms, like they'll not be able to sleep, they don't feel like eating, they're not feeling lethargic over the day, they feel fatigued. But if I ask, why do you feel this way, they'll have no answer, because that's the only thing that they are able to express.
One of the things that I've also seen, something as simple as acidity, that adults don't know this, that your stomach creates excessive acid when you're stressed out. Because whatever is left over in the stomach, your digestive system has to quickly make that into glucose, wherein you can run away from danger.
It could be their heart is racing, they're having palpitations, tightness in their chest, they feel a heaviness in their head, or their arms are shaking, there's numbness in the body. I've had clients who've reported these number of symptoms and they feel like, it's just my legs are paining.
So if, let's say, for someone there is frequent bouts of acidity, what's the easiest thing to do? Pop up Andy, pop Eno. You realize that, okay, my last blood reports showed this, my cortisol level was high, and Eno is just a band-aid. That's when, they go to a gastroenterologist, or they would maybe go to an endocrinologist. What's happening? Nothing really jumps out in your medical reports. And then when we talk about it, we psychoeducate and we bring that awareness. And that's when they realize, so high stress also gives rise to anxiety.
Because as I said, they are able to explain their symptoms, but not their experience of what they feel. But anxiety symptoms are very real to them.
Yeah.
Okay, such as palpitations, tremors, shivering in their hands and their limbs. Those symptoms are very real for them. And when people are anxious, it gets very difficult for them to sleep as well. So then that becomes a serious issue for them, because then it kind of impacts their work as well. So a lot of things gets impacted because of it.
Your body needs to feel stable. Your body needs to feel safe. If your body is not feeling safe, your body is not stable, anything beyond that, I've experienced as a therapist, has lesser efficiency to work.
So what are more healthy ways? And then also, what are these unhealthy ways in which men channelize it?
Okay, when I talk about healthy, you just try to use it in a understand what happened, what was the situation, why did it go wrong, analyzing the situation, having a bit of introspection of what made this situation. But the unhealthy ways, let's say you're kind of not able to recognize your emotions, but you're feeling the pain, you are aware that you are feeling that pain. Okay, now to remove that pain, you're kind of resorting yourself to, let's say, some kind of drugs, or let's say smoking, or let's say alcohol.
Engaging or indulging too much in their addictive patterns. Maybe there is substance abuse, too much alcohol, too much cigarettes. They are spending a lot of money in behavioral addictions, maybe gambling, video gaming, and they end up also feeling like, what did I do in the entire day? Again, links to productivity.
So they do have the power to relieve that stress for a moment. They do have that power, but that would have been healthy if it helps the case for a longer time. But that's not the case.
That's not the case. True.
That's not the case. It's kind of harming the body physically as well, and that's not a good coping mechanism.
The men that make it to my therapy room are men who are struggling at work. Some of them have been forced or pushed by their team leads, their HRs, because they've seen, maybe for example, more number of absenteeism. They've seen that this particular person is falling sick quite a lot. This person is not as productive as they were a couple of weeks or couple of months back. So if your occupational functioning is affected, that in my experience has been the biggest tipping point for men, because they are expected to be protectors. You have to be the breadwinner. If you lose your job, you can't be a breadwinner. That's one. If there was an incident wherein, let's say, something happened and a man was not able to protect their loved ones, that man starts feeling less masculine. And I don't
Right.
say this as an overgeneralizing statement, I'm just using it as an example.
It's the idea of a man who has to work and get money in the house, so they don't have the chance to complain about a lot of things.
So when you kind of promote hyper masculinity, you're also kind of promoting patriarchy as well. That is what it is going to lead up with. So that is not healthy for the society itself, let alone the individual himself, because hyper masculinity is something which kind of compels the person individually to kind of be insensitive to their emotions and kind of work hyperactively, and just problem oriented, do all those stuff.
For a lot of men, if they're not doers, if they are not, you know, if efficiently contributing towards being, productive members of the society. Another thing is also if they are pushed by their immediate family members, their wives, that if you don't go to therapy, you don't get your act together, so to speak, this marriage is over.
So, in those cases, when they do come to a therapist, it's like their last option. It's like that's the only thing left to do for them.
They do comply with the treatment because they know that their behavior or their life is kind of impacting the people around them.
Okay.
Okay, so that is when they mostly come, especially in government hospitals. They only come when they are kind of being brought and compelled by their family around them.
It's being seen as a last resort
Yeah,
versus it
yeah.
ideally being a first, second, third resort.
They might have tried to reach out to some people who wouldn't understand what's happening with them, or who would dehumanize their experiences or just make them very small, that okay, this is the entire thing, you just lost your job.
How do you, as a man, as a woman, how do you resolve that inside of you, or how do you unpack that with you? You need someone to kind of do some form of brainstorming to be able to say that, hey, maybe you didn't have the skills at that point to be able to protect XYZ people.
Have you dealt with people who are on the brink or who were considering it? They've been able to open up to you, A. And B, is there a specific protocol that has to be followed, which you tell the patient so that they maybe calm themselves down or this thought sort of goes away? Or is there like an emergency protocol that comes into place?
I usually have dealt with patients, especially men, who are kind of contemplating about whether they should kind of commit suicide or not.
They've been
Uh,
honest and open about it in the first
yeah,
session.
they've been honest about it. Yeah, that they are having thoughts and they're kind of contemplating that whether they should, kind of go for it or not. How a person can come up to a thought that okay, they are kind of contemplating suicide is because they're kind of losing hope. Okay, now what happens is the reason they might be losing hope is because probably the situation that they're currently in is not very good. Okay, now situations when there are tough situations, hard situations, it is very difficult for a person, especially no, I won't say especially, but for any person, if they're in a difficult situation, it is very difficult to think optimistically. So all you have is pessimistic thoughts.
When someone talks about suicidal ideations or thoughts of self harm outside the space of therapy, people in general don't know how to respond to that.
That's when we kind of do a suicide risk assessment. So that's kind of assessing that how probable do you think that the patient would commit that, the suicidal ideation of them, whether it's high, whether the risk is very high that they'll commit very soon, or so that's an assessment that we usually follow so that we are able to understand what is the situation, I mean how risky it is for them.
When you're talking to a person who is on the edge of suicide, it's actually helpful to talk about it, to ask them that do they have a plan for it? How do they tend to, think about it? How do they plan to do it? Do they have access to the means to do it? This kind of conversation helps you understand that what is the level of risk that they're coming at, and how you can form a safety plan for them, how you can get them the help that they need. So it's very important to not tiptoe around these issues, but be very genuine to ask them about it and then refer the help to them.
So if we know that there's some risk involved, if the risk is high, we do definitely inform the supportive people around them.
Okay.
And that could be a family member. So we kind of try to incorporate every kind of protective factors for them that can, help them in that situation.
Understand the level of risk that that person is at and create a safety plan for them, get their emergency contacts in place. Then you reach out to those people because you don't want that person to be alone right now. Where they are, how they're doing, they can't be alone at that moment. So the help should reach them instead of them going to the help. So that's very important. And once there is someone with them, they can, get them to talk to a therapist, or they can get them to a nearest hospital or emergency room where they can get the help that they need at the moment, and give them time to actually sit with that, because it's often noted that once the process of moving from the thought to actually the plan is delayed, certain times the idea of suicide leaves the mind of the individual for a longer period of time.
What, let's say somebody's now made that effort, whether there's an ultimatum in life, whatever's happened, somebody stepped into the room now, right? Typically, what are the first 5-10 minutes like for that male person who's come?
These are specific questions that I need answers to before we actually jump into it.
Right.
So a couple of things that we ask is your basic demographic details, an emergency contact, ideally 2 emergency contacts, family history in terms of medical history, psychological history, personal history in terms of medical and psychological, the last, let's say, blood test that you had, if you have the reports, what came out of it, etc., etc.
So, how do you dismantle this thought that men have? If you're coming to therapy, you're not weak. How do we break this pattern?
For example, the example that I gave about myself, that if I used to cry and I would used to be called a girl, now that is something that I've generalized in my mind, in the sense that if I cry in front of anyone, people will call me a girl. Okay, so that's the because of that equation, because of opening up. So that's what I kind of conclude, that if I express what I have in my mind or in my heart, if I express it, then why is it considered weakness? Is because I'll be perceived as a weak person. Now, what we in psychotherapy are kind of addressing is that what expressing your vulnerability is not considered weakness, because we are not looking to judge that person. What we are trying to do is, by understanding the situation and the problems that they're going through, we're just trying to equip that person with the strength that is needed, with the skills that is needed to adapt to the particular situation or the problems that they're facing.
Anyone comes to me as a friend, as in my personal life, if they ask me, why is therapy important? I'm like, important hai because when you're sick, your stomach is unwell. What does your stomach do? They're like, you either get diarrhea or you get vomiting. I'm like, you're doing the same thing for your mental health. Go to therapy, दिमाग की emotions की उल्टी करके आ जाओ, बस. Put a very hard limit with your therapist. I am only here to vent. See what happens.
If you made it this far, it means that either you relate to some of these things, or you had these questions, or you know someone in your life who might need help. Whatever it is, I'm glad you're here. And if there's a man in your life who needs help, share it with them. This could be their nudge, it could be their cue to actually go and take help. What we've also done is that in the description, we've attached a document with some resources that men can claim to take help. There's clearly still not enough conversation about men's mental health, and this was the purpose of this video, to make it very transparent, hear it directly from the horse's mouth, and try to really understand why is it that men who need help are not taking the first step. And with that, we're done. I hope this video was helpful, and it does help at least one person, at least one man get better. Thank you.